Hello, I'm JoAnn Sanchez. We welcome you again to this week's edition of Your Active Life, your orthopedic educational community program. We'd like to thank Affection Home Care for helping make this program possible. By my side, Dr. Raul Marquez.
Hello, and thank you for joining us.
Our goal during this program is to provide you with some valuable health information that will be beneficial for you and for your family. On today's program, we will be discussing sports medicine and its relationship to orthopedics. When we think sports medicine, we immediately associate it with injuries caused by some type of sport, whether the injury was a recent one or one that may have happened years ago. Pulled hamstrings, what are those? What do we feel?
Well, pulled hamstrings, basically, what they are is partially torn muscles on the back of the leg. The hamstrings are there are four muscles that are in the back of the leg that go from your butt basically to the knee. That's what we call a hamstring, and they're common in type of injuries in soccer, football, or any injury or any sports that basically need the high speed or a lot of twisting type of injuries.
You also mentioned that a shoulder impingement is a common sport injury. Could you explain a little bit more what a shoulder impingement syndrome is?
Well, to make it short, shoulder impingement syndrome means an inflammation of the rotator cuff. The rotator cuff, there are four muscles around our shoulder. We explained it a little bit before in previous programs, but what happened is because of the overuse injury or overuse use of the shoulder, what it does cause is a lot of inflammation just under this bone, which is called the acromion. And the old doctors used to call them a tendinitis of your shoulder, but basically there is no tendinitis, it's an inflammation of all those shoulders. That's what we call a shoulder impingement syndrome, because the bone is pinching right on the tendons around the
What kind
shoulder.
of sport can lead to this impingement syndrome?
Well, there are several sports that are more commonly cause impingement syndrome. The most common ones are baseball, because we need to use our shoulder quite a bit. Also boxing or self-defense type of sport like karate or those type of sport, because we need to or they need to move their shoulders quite quickly, and that leads to an acute inflammation of the shoulders. Also swimming is very common. We see impingement syndrome in swimmers.
How about tennis elbow? Where do you see that?
Well, tennis elbow is self-explanatory sometimes, but it's obviously most common in tennis. We have a why, because when we use the racket, you always put a lot of effort on the forearm, and tennis elbow means pain just in the outside part of the elbow. This is due to the repetitive movement, but also can occur in carpenters, for example, because they use the hammer quite a bit. So any type of activity that leads to repetitive motion on the elbow and it causes pain on the outside, basically we call them a tennis elbow. To change from the outside to the inside, we call this the golfer's elbow. Why? Because the golfers usually use the hand in the opposite way, and they have a lot of pain in the inside of the elbow, and that's what we call them a golfer's elbow. Another type of common elbow injuries are what we call the little league elbow. The little league elbow occurs very commonly on pediatric patients, on children, because they throw the ball in a manner that they force this part of the elbow, and we see it in children quite commonly, but also can occur in athletes too.
We had the opportunity to go into the community in support of a pediatric health fair. There were individuals that had a couple of questions for you. Let's take a look.
Dr. Marquez, I have a question. My daughter's a volleyball player in the local high school here, and she's fallen a few times, and now she complains of like a little ball rolling around in her knee. And I just wanted to see if if you knew what that was or if you can help her out.
Well, first of all, thank you for your question. And I wanted to congratulate her because he's obviously a sports person and he's an avid volleyball player. One of the things that pops on my mind, first of all, is what we call a ganglion cyst. A ganglion cyst, because she's a volleyball player, she jumps a lot and she goes and falls down on her knee. One of the consequences of this repetitive activity could be a ganglion cyst. And ganglion cyst, what it means is just a little piece of tissue that accumulates fluid. And in general, we think fluid like water, but no, this is fluid from the joint space. And once accumulates, it gets a little bit like a jelly type. And that might be the reason why she might feel that something is rolling around her knee and she can touch it. And sometimes it gets swollen, sometimes it gets smaller. That depends. So that would be one of the possibilities. That is a very common injury in the sports related, mainly in volleyball players, because they are primarily jumpers. The other possibility, which is also a little more serious, is that she might have a piece of cartilage inside the joint, what we call a loose body or an osteocartilaginous body. That means a piece of cartilage, a piece of bone that is rolling around the knee, which I think that'd be another possibility, but that implies that something broke inside the knee. And a lot of volleyball players, like in her case, they are tough and they like to keep playing with that. And I think should be consulted with a doctor, an orthopedic surgeon should be able to take a look at her knee. But if she's able to play, she's able to move around, and it feels like just rolls around the knee, that I think I'll, trying to make the diagnosis by on TV is I would say might be a ganglion cyst or just a subcutaneous cyst. The other possibility, which is also very possible, is that she might have a bruising that basically was encased in scar tissue and fibrous tissue, and people have little bruises there that they become almost like a marble and they roll around the skin. That's an also high possibility for her because she's a volleyball player, she falls a lot on her knees, and usually kids are very, very tough to, after the game, and they don't like to complain. But one of the things for sure, I will consult an orthopedic surgeon or your family doctor.
We have come to an end of this program. We hope that this valuable information will serve as a tool to help you make important medical decisions for you and for your family. We'd like to thank all of you for the support you have given us.
It is very rewarding for us to be able to educate you, our community. Please continue to call or email and send us your comments. I would like to remind you that all these topics discussed in this show are for educational purpose only. Every case and individual is different. But if you have any questions, please contact your doctor or you can call us at the office.
Once again, we'd like to thank Affection and Home Care for helping make this program possible. Thank you for being with us today, and we'll see you here next week.